one of the most nerve-wracking things is to come on without makeup. I think about it every single time. I think about it all the time. But the truth is, I work for myself. I spend a lot of time outdoors, and I'm working with oils, so I don't put makeup on for myself. And there's something that's really eating at me, and I have to share it with you because it came about with this. This is a salve that I made for someone who recently went through a cool leaf procedure. And actually he went through it in November, and he's been experiencing headaches ever since. His wife, I've worked with the family for years. This is an Amish family. And by the way, I've actually worked with Amish people for 10 years now. And the thing is like, I've known this family for a while. And this gentleman went to Mexico to have this treatment. I'm not going to say I don't know why. I do know why. It was cost. He went all the way to Mexico because it's less expensive to have certain procedures done. I mean, you probably are familiar. People go to Mexico for dental work. People go to Mexico for plastics, and injectables in their face, plastic surgery. I even know people who've gone to Mexico for things like heart surgery and so forth. So the medical treatments are far less expensive in that country. And what I'm experiencing through my own experience with my own clients is that there is no follow through. They're just released, and these people are left to take care of themselves. And even with the heart surgery, I kid you not. And what's even more concerning is the lack of collaboration. And I'm not pinpointing, Mexican physicians. I'm not saying anything about that. I'm not saying anything derogatory at all. I need to make sure that I'm upfront about that. This represents a bigger problem, and that is the lack of communication between professionals. Now, one thing is we have lack of communication between allopathic and complementary and alternative professionals. There's not much collaboration there. I've experienced this firsthand. And then there's the lack of collaboration between professionals in one country to professionals in another country for the sake of patient care. And in this case, this gentleman went, like I said, he had a cool leaf treatment. They released him with, well, the way she described it is pills. They came home with pills. My question was, are there medications involved, or was he prescribed medications? And she says, I don't think so. She says, what I have is just all written in Spanish, so I don't even know what these are. Now, this is 2 months. He went for neck pain. It is, if you're not familiar with cool leaf, it is a protocol that's in lieu of prescribing opiates. It is somebody's answer to lessening the opioid crisis. And I've not known anybody else to go through the treatment, so I can't say if it's successful or not. What I do know is that it is obviously a practice that is being trained to certain professionals, and then they're being, and it seems to me like it's based in Atlanta, from what I can tell. And it is a pain relief. What they're doing is they're deadening nerves, and it's supposed to last for a year. In this case, this gentleman had neck problems. He went, and now he has ongoing 24/7 headaches. Nobody to help him. So they contacted me, and because we cannot read this, I've been trying to track down the professional in Mexico. She's searching for the phone number for me right now so I can pinpoint what medications or what supplements or what these pills are, so that I know whether or not this is going to work with that. And if it's not, we're going to have to change the way he's going through his post-op or his post-treatment care. That is the problem that I'm getting at. This is what, I mean, it's actually bigger. I may do a series of videos on this, because the way we are thinking, like I said, the collaboration between the two worlds is nil, or very next to nothing. And then, or we have professionals in this country, the United States, wanting to do it all, And while there's nothing wrong with having, a nice array of options available to your patient and clientele, it would be beneficial to have more sets of eyes and ears in the process, because we all have different perspectives. And in this case, one of the things that was asked of me was, well, what oils are you going to use for the headache? The thing is, it's not just the headache. He had a neck problem to begin with. And although I'm not, it's arthritic in nature, there's a lot of inflammation happening in his neck. I am very familiar with how to work with diagnoses. And at the same time, all I need to understand is where this malady is located, get a bigger picture, like how well does he sleep? What is his digestion like? I can tell you straight up, even if he doesn't have indigestion, even if he were to tell me his digestion was stellar, I'd say, no, it's not. The only way it could be is if you were devoid of inflammation. If you have inflammation in your system, your digestive system is out of balance. It has been reduced. The energy for digestion has been redirected to producing inflammation for the sake of protection. So that's just it in a nutshell. So I don't care if you don't have any digestive disruption or disorders or discomfort. If you have inflammation in your body, you have a digestive problem. You have an issue within the digestive system, and it could very well simply be you're not breaking down macronutrients well enough in order to sustain a body that is well. It is being broken down in such a way, like I said, because it's producing inflammation. So the nutrients are being used differently, and ongoing ongoing disruption to the metabolism of macronutrients promotes the advancement of inflammation. So I take that into consideration in this. Because he has headaches, it could very well be that these supplements are promoting some sort of detox, or they could be stimulating a detox process. I don't know what they are, in which case rapidly detoxing bodies, and they can't eliminate it fast enough, is going to lead to headaches. The chances of that happening are significant. So I take that into consideration, which now means the lymph system and the elimination system. Okay, so all of this needs to be taken into consideration. These are how this is really kind of an insight as to how I blend. And this is what I was explaining to her. This is not just headache relief. He has a neck problem. He's got inflammation in the neck, which means there's inflammation throughout the body. So we need to take all of these systems into consideration in order to help reduce that and slow that process down so that the body can stabilize on its own. That is how this works. And so in the meantime, this is a request that if you are an alternative and complementary medicine practitioner, please collaborate with allopathic professionals. If you are an allopathic professional, please collaborate with the alternative and complementary medicine professionals. That is the true definition of holistic health. And then, no, I take that back. I just lied to you. Sorry. That is not the true definition of holistic health. That is the true definition of integrative health. Holistic health takes into consideration the whole system. It looks at symptoms as a red flag for systemic distress. The true definition of holistic health is the integration of all the modalities that a person chooses to get involved with that factors in every system. Medications cannot do this. This is the reason why you want to add complementary and alternative medicine. I know I've mixed these words back and forth. I get that. That's okay. You understand what I'm saying. So that's why those two worlds must work together, because medication does not take the whole system into consideration. Complementary and alternative medicine begins to touch on it, yet we're still working in that realm with a conventional mindset, which is symptom relief. An unconventional mindset is going to take that symptom and realize it is systemic. It is a red flag for systemic distress. And now it takes the whole system into consideration. That's the definition of holistic health. And that's what I'm doing here. Because ultimately, the patient's or the client's success is dependent upon how well his body responds. And it also depends upon how well he works with this, because no two bodies are going to react to it the same way. In fact, that brings me to one more final point. And that is, when she asked me what oils I was going to use for a headache, she started to rattle off a number of oils that other people have suggested. Well, the fact is we have different reasons why there would be a headache in this case. Another question she wanted to know about was lumps in the breast. She was under the impression that she could use frankincense for a lump in the breast. Well, a lump in the breast could be a lipoma, which is a fatty tissue buildup. It could be either a benign or malignant tumor, which is different than a lipoma. It could be a cyst. It could be a blocked duct, or it could very well be a backed up lymph system. Frankincense, I could see, would actually move the lymph system more so than it would shrink any other type of tissue. And there's a whole reason behind that. And frankincense is not going to be the only one that's going to be recommended. And again, it depends on what's going on with the person. And most importantly, it depends on whether or not the person really wants to be better. Sometimes symptom relief is all we want, because that is what makes us feel good in the moment. But if you want to transform your relationship to your body and transform your relationship to health and have an entirely different experience with health and wellness, then systemic relief is the way to go. So anyway, thanks for listening. Thanks for putting up with makeup free. And yeah, here's to a healthy and well weekend. Take care.